Over my 25-year medical career, the most common and easiest to prevent mistake that I've routinely seen doctors make is not diagnosing or preventing iron deficiency anemia. This problem is especially prevalent in women and young women, and it drives me crazy because it's so simple. It's almost like it's too simple, so doctors just kind of like, whatever, it's too easy. So I'm going to explain exactly what you need to do to prevent this from happening to you and how to treat it if it does happen. Hi, I'm Dr. Stephen Wangen, and iron deficiency anemia is a super common thing that causes fatigue, which can also lead to many other problems. And it's particularly common in women because women lose iron every month. Now, it's also imminently preventable, but unfortunately, doctors often don't run the simple tests that could prevent it. And even when they do run tests, they usually only run tests that tell you that you are iron deficient after you're already anemic. So, what's the difference between being iron deficient and being anemic? Because there is really a huge difference between these two things. Now, anemia is a deficiency in your red blood cells. And so when that happens, you can't form your red blood cells properly and you can't carry oxygen around your body, which you need for everything, right? For absolutely everything, we all need oxygen. And if your red blood cells can't form properly, then you don't get enough oxygen. So anemia is diagnosed with a test called a CBC, or complete blood count. And this is probably literally the most common and simplest blood test that there is. It's very inexpensive and it's performed thousands of times every day by doctors all across the country. There's nothing new or unique or special about this, and it's great for finding anemia. Now, every single teenage through premenopausal woman should be having this test run every single year. Literally, I just can't emphasize it enough. There's no excuse for not running the super cheap test, for your doctor not running it right and your insurance paying for it. And if you visit your doctor for a physical and they don't offer to run a CBC, request it. Seriously, this is especially true for teenage athletes who get their sports physicals, because athletes need even more iron than the average person. So be sure to have your doctor run a complete blood count, or what we call a CBC test, because it could make a huge difference in your life. I just can't emphasize that enough, and in your athletic performance, if you're an athlete. However, that's not enough, because iron deficiency anemia will only show up on the CBC after your iron reserves have dropped significantly enough that there is no longer enough iron in your body to properly form your red blood cells. So only when that happens will your RBC, your red blood cell count, be low. And then your hemoglobin and your hematocrit will likely also be low. Now, there might be a test for iron on your panel, and your iron reading will likely be normal, because the iron, which is literally called iron, like we all know about it, the iron that's on the lab work is not a measure of your iron storage level. It's a measure of the amount of iron floating around in your blood. And that's really, those are two completely different things. Because although it sounds important to measure iron and sounds really helpful, it's actually usually not very helpful, because your iron storage level is measured by another test. And that test is not part of the CBC. And that test is called ferritin, Ferritin. So keep that in mind. Ferritin is not part of a routine CBC. It has to be ordered separately. And so therefore, this is the other test that you want to make sure that your doctor is running, because it's the test that's going to predict your anemia. It's going to tell you if you're getting close to becoming anemic. and it'll allow you to prevent yourself from getting to the point that you develop iron deficiency anemia. Yeah, it's a great test. Awesome, right? Also, you can be suffering from fatigue and the symptoms of iron deficiency before you develop what normal lab values will tell you is iron deficiency anemia. And you can see that just by having low iron storage levels, which are known as a low ferritin level. So doctors don't run this test routinely, and many doctors just don't run it hardly at all. And unlike the CBC, which they do run a lot. So if your ferritin number is less than 30, then your iron storage level is too low. And if you discover that sooner rather than later, then you can start taking iron, and you can prevent the iron deficiency anemia from ever happening. Right, that's awesome, right? That's what we want. I mean, that's what true preventive medicine is. So I love that. So, and it's very easy, simple thing to do. So I'm going to talk also about how to treat it in a moment, but let's just summarize all the stuff I just talked about because it can be a little confusing. So every year, test your CBC, which is your complete blood count, and your ferritin level, especially women. So two simple but really important tests. And ideally, you'd like your ferritin value to be about 75 or higher. And yes, there is actually a way to get too much iron eventually. I mean, it's pretty rare, but if you got something well over 200 or thereabouts, it might be too high. But if you're menstruating, then that's incredibly unlikely. That's probably not going to happen except in rare cases. Okay, so now you've run the testing, right? And you know that your iron is low. So what do you do about it? How do you treat it? Well, of course, you need to take iron supplements, but that's sometimes easier said than done. And iron can be hard on the digestive tract, and many people experience digestive upset or constipation when they take iron. So there are ways to improve this. You could take an easier to digest form of iron that will often make a big difference and help with this. And there are a few types and a few ways to do this. Now, there's one popular product called Slow Fe. Fe is the periodic table of elements symbol for iron. And this product can help with digestive upset because it's a slow release form of iron. And a lot of people have found it helpful. Unfortunately, it's also full of a lot of artificial garbage, so I'm not a big fan of it and I don't like to use it. Now, there are other options. I prefer a couple of really nice forms of iron that I've linked to below. And one is a really high quality and very clean form of iron bisglycinate that most people tolerate really well and that I recommend in my clinic. And you want to get about 25 milligrams twice a day. And this particular product, 25 milligrams, is one capsule. And generally, you probably take it with food, probably going to digest it a little better and absorb it a little better. The other thing that's really nice for people who have a lot of trouble taking in iron orally is an iron patch. Yeah, I bet you didn't know that. A lot of people don't know that because it's a fairly new thing, but you can absorb iron through your skin. And it's a great way for people who are super sensitive to iron to get iron into their body. And so you can get iron patches. I've included a link below to a really great iron patch product that I also recommend to my patients. Now, once you've found an iron that you can take, the next question is, well, how long should you take it? And if you have iron deficiency anemia, there's some really good ways to figure this out. You should know that you're going to want to do a lot more than just correct your anemia, because you can correct your anemia maybe within a month or two, but that's not enough, right? You want to prevent it from coming back. So you want to prevent yourself from constantly going in and out of anemia all the time. And in order to do that, you have to raise those ferritin levels, right? Those iron storage levels to a really nice rate, a nice place, so you're not near being anemic. So in my experience, when patients are taking a really nice absorbed form of iron like the ones I've mentioned here, they generally only increase their ferritin number, that iron storage number, by 3 or 4 points per month. So your ferritin might be, say, at 20 or lower or whatever. It could be at 10. Some people are even worse. By that point, you're almost always very anemic. So it takes a while, right? What do we say? We're trying to get it to about 75 or so would be ideal. So that means, depending on your current ferritin level, it might take a year or more before you get to a really good number, a really good iron storage number. And even when you do get there, you'll still probably need to be taking some iron, women anyway, who are menstruated, to keep it there. So you should recheck your ferritin every so often. Annually would be great, so that you know how well your iron treatment is working. All right, good luck restoring your iron levels. I'd love to know more about your challenges and your successes with iron deficiency in the comments section below. And I hope that you found this video helpful. And if so, please give it a thumbs up and subscribe to my channel for more practical information about how to improve your health. Thank you for watching. We create informative videos like this weekly. So if you enjoyed it, please help our channel by sharing a screenshot or the link to the video on Facebook or Instagram or your favorite social media. And be sure to tag me wherever you post and let me know what you liked about the video and what topics you'd like me to discuss in the future. If you visit our website at ibstreatmentcenter.com, we're currently offering a free ebook on how to beat IBS, so be sure to check that out. It's time to take control of your digestive problems and get your life back. I'd also appreciate it if you could subscribe to our channel here, like this video, and leave a comment or question below. I'll do my best to read and respond to all of them. Thank you, and until next time.